temporal lobe, occipital lobe back here. We went out the frontal lobe. If I want to go the temporal lobe, which one of those arteries would I have to go out? Middle cerebral. Take me out to the temporal lobe. Okay? So, I'm draining from my frontal lobe. So I know from that skull cap that I just saw, I have a superior sagittal sinus. So you can see that here. See that blue? Superior sagittal sinus. So that's superior sagittal sinus comes down here and dumps here. This area is called the confluence of sinus. Then we had everything coming on the left side. So this is my left transverse sinus. And see how it comes and dumps down in this direction. That's my sigmoid sinus. So if I'm looking here, you can see your whole sigmoid sinus into that jugular foramen. And then from the jugular foramen, you have your left internal jugular vein. And then your left brachiocephalic vein. And then, of course, the superior vena cava. Now, when I'm looking at my circle of Willis in here, I can see my vertebral artery coming up right here. Vertebral comes up and forms basilar. This is my anterior inferior cerebellar artery right here. This model shows you Lamberthine artery, which goes in the ear. This is basilar. These are my short pontine branches here and here. This is my superior cerebellar artery. And then this artery right here is my posterior cerebral artery, which gives me my posterior communicating. This at the very top here is internal carotid. This is middle cerebral artery. This is coming around this way, that's anterior cerebral. And this is my anterior communicating. This branch right here is posterior communicating. And these two anterior arteries lie right on my frontal lobe. Now, again, all of this blue here is showing my venous drainage back out of the brain. Okay? We even have a sphenoparietal sinus, and all of this is my intracavernous sinus. Inferior petrosal sinus, superior petrosal sinus. And see how both of those dump right into sigmoid sinus. So you have your arterial flow there and your venous flow, and you also have a diagramming